I see your maybe every year and this year as well, your pool of patients, your market size, slowly shrinking a little bit, which just means on top of the competition that you have, you're now fighting for a slightly smaller pool of patients every year. So how are you going to stand out? How are you going to be valuable?
Welcome to Off the Chart, a business and medicine podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. My name is Austin Luttrell. I'm the Associate Editor of Medical Economics, and I'd like to thank you for joining us today. Before we get started, a quick note. Physicians Practice will be hosting a Practice Academy event on March 19th, offering practical guidance for physicians and practice leaders on a range of business and operational topics. More details on that will be available soon. But with that said, in today's episode, Medical Economics Content Vice President Chris Mazzolini sat down with Carl White, the president and founder of MarketVisory Group, to talk about the marketing realities facing independent medical practices. They discuss how competition for patients has intensified, why simply providing good care is no longer enough to stand out, and what practices should focus on to stay visible and relevant. White also shares practical guidance on differentiation, patient retention, and how tools like Generative AI will fit and don't fit into physicians' marketing strategies. Carl, thank you so much for joining us, and now let's get into the episode.
Carl White, thank you so much for joining me on the show today. I really appreciate it.
Thank you for having me. Happy New Year.
Yeah, Happy New Year to you too. Independent practices, they're fighting for attention. They're fighting for patients. There's a lot of competitors out there, whether it's urgent cares, convenient clinics, hospital-owned practices. There's the practices and competitors arrayed against them are just growing more numerous right now. So what do you see as the biggest marketing challenges that these independent practices are facing now as we are, kick into 2026?
I don't see them as terribly different than before, just maybe a little more squeezed. So if you're a marketing plan responds to a growth need. So if you need to grow a lot, all other things being equal, or you need to replace a lot of patients, you need a bigger marketing plan than if you don't. So the way I sort of framed it is, if you are a traditional insurance, then it's the affordability of insurance. And so as an example, I was just talking to a friend yesterday. Tim and his wife, they have one child. They've decided for 2026, they're going to buy health insurance for their child, but not for them. And they've never done that before, because the premiums, just the right to schedule an appointment is well over $20,000 for the two of them. And they're healthy, but here we are. So if you're traditional, I see your maybe every year and this year as well, your pool of patients, your market size, slowly shrinking a little bit, which just means on top of the competition that you have, you're now fighting for a slightly smaller pool of patients every year. So how are you going to stand out? How are you going to be valuable? We'll get into that a bit. The other side of it is if you're private pay. So that's growing a bit. Whether you're a traditional practice trying to add more private pay services, or you're a private pay from the ground up, your pool theoretically is getting bigger, you would think. But it's still, healthcare is weird here in the United States. Is it a right? Is it a good? People still have this sort of reflex of paying out of pocket for healthcare. So your job is to convince them that what you have is it's a very generic way of answering. It's valuable. If I'm going to pay, $200 for this visit, whereas last year I paid the copay, what am I getting more? And there's one thing I see. There are some parts of the the private practice world where that makes a lot of sense. Private care, we're seeing that there's nothing new about those models anymore. But I see others saying, well, I want to do this because they'll pay for it. Are you sure? Like, what's the unmet need? Is it really there? For example, I've heard of a couple people opining about the idea of maybe I'll do a concierge pediatrics practice. And my first reaction is, we never have a hard time getting into our pediatrician. So what are you going to offer? So that's what I see, whether you're insurance based or not, at a very macro level. That's kind of like, they're not thought of typically as marketing challenges, but that's kind of what it is.
Yeah. So I think, in the good old days, and maybe this is more of a story than the truth. The idea was that a physician can hang out their shingle and the patients would just come. It's like the field of dreams. If you build it, they
Right.
will come, right?
Yes.
And
Yeah.
and now, you have to, like you were saying, you have to fight for and work for and grind for every
Hmm.
patient to a level where maybe you didn't before. Um,
Hmm.
and I think some physicians maybe still think like, if I just practice good medicine and take care of my
Hmm.
patients, that things will take care of themselves. Like, so what do you say to that sort of attitude?
Well, good care is a must. It's a must. And it's actually, this is a bit overstating and saying it, but it's fits with the theme. It's not marketing, but if your service is bad, generically speaking, no amount of marketing or promotion is going to rescue it. So your clinical care must be good, but that's expected. And the truth of the matter is, any patient who's sitting on the outside looking in is saying, we're looking for a pediatrician. Let's just pick that example. And I find five of them that all sound really good. The clinical care, I can't tell who's good or bad from the outside looking in. And it's supposed to be good anyway. I mean, that's not really, it shouldn't be much of a differentiator. The second part is to say to the one who wants to hang their shingle and do nothing else, my friend, you have competition. You just do. And it's easier and easier to find them and to try them than it every year. And so the fundamental question is, why are patients going to choose you when they find you and your competition, whenever that may be? That's kind of the way in. Just like you, Dr. X, when you go to purchase something, you comparison shop. So do patients. It's a very rational behavior, and it's not based on price if it's insurance based. So what are you going to do? You can choose to ignore that. That's your choice. But unless you've got a really good competitive, competitive position, maybe there's not that much, or you're just the name, the machine is humming. All these things count as marketing. But if that's coming up short, then something's got to fill that gap.
Yeah, and I think we'll get into that a bit later about what are some of the things that
Yeah,
physicians can do.
yeah.
But I think we have to talk about like the elephant in the room, which is, generative AI, ChatGPT, whatever service you want to kind of
Yeah.
discuss. But like, I think any form of content, so including marketing content, there's just a
Hmm.
glut now, There's this term of AI slop. There's just like, you can just like produce content on a whim
Hmm.
and, so I guess the question is, how does that change the playing field when it comes to marketing, the sort of the use of AI? Like, is AI something that can actually help physicians market, or is it more of a challenge that they get around, or is it a bit of both? So what are your thoughts on AI and marketing and where we are right now?
So, yeah, I mean, I break it down. I take the world view of, you are a private practice in city or community X. There is some reasonable radius around your office that is your kind of your hunting ground. And that's when we approach clients, we say, we want to win there. It is true, some travel further. Yes, those are more the exceptions, the further away you get. We must win in our core area. If you take when somebody fires up ChatGPT and they're staring at that prompt area, there's broadly speaking two types of prompts. This is my own, I didn't come up with this categorization. First one is called teach me. I need to learn about something. What does this mean? What is it? Whatever it is. As a local practice with the time and budget constraints and realities that they have, I find that difficult to win. When I say I want to win in this hunting ground, if you are, we'll just stick on pediatricians, um, is the MMR vaccine safe? You know, do you really need to be the one to answer that question? And, we know some of where ChatGPT goes. What's interesting is Gemini, which is owned by Google.
Mhm.
Um, Nobody's said this, but it sounds really logical, is that Gemini relies more on Google's sort of database than anything else, whereas ChatGPT looks around. But it's very difficult to win in the teach me types of prompts. If you want to, I say enter carefully, have a goal. Like, is there one or two questions? Start, figure it out, maybe expand from there. The other type is recommendations. Who are good pediatricians in my area? Now, let's try to win there. And when I run tests for my clients, um, I find highly similar, not always the same recommendations as what I'd find in Google. And why is that? Because ChatGPT, let's just pick on them, not owned by Google, smartly says, well, I need to give an answer to this question. I don't know, but I'm going to go find sources I trust, one of which is Google and the reviews and Yelp and everything else. So if you're winning on the local online game, you're probably going to do okay, maybe the same as wherever you are in recommendations. So if you want to win on AI in the who are the best service providers near me, make sure you're killing it on search first, because you're not going to overcome that if you try to skip it over. That's what I would say for that. As far as like the content, yeah, content. If you're going to do that, step one, make sure you quality control it, both from clinical accuracy as well as does it sound like you, Dr. X or whoever, and don't gloss over that, because just don't gloss over it, because there's two audiences to anything you publish online. There's the people who read it or skim it, and then there's the search engines that look over it as well. They're pretty smart. Do you really, and if it doesn't sound like you, if it sounds like what it spits out, you're going to sound like everybody else. Now, for whatever reason, a lot of people discount that online. But if you were in a on a panel and somebody asked, an expert panel, and somebody asked the person next to you a question and they gave an answer, would you want to give the same answer or say ditto? No. I mean, unless it was you really had nothing else to say, but that's not you. That's not what you want to be. So apply the same. Does this sound like the way I would say it? Now that's on the content side. Interesting kind of side point. If it's more internal operational, like for example, you got a denial of coverage letter from Aetna. Man, I'm meeting a lot of people who say ChatGPT is awesome in helping me craft the response to that. And so you know what? And people who are like in billing companies who are, looking at that going, I should be doing that. But, why not? I mean, your audience is just Aetna in that example. But like the publicly facing, this is the type of practice we are. This is what we stand for. Things that you should be thinking about. Does this sound like you in the way you would say it? You can train an AI to learn you over time, but you got to do that. So just because it can spit it out in 10 seconds and that's really cool doesn't mean it's worth, publishing.
Yeah. Okay, great. In terms of getting noticed in today's, noisy, busy, sort of short attention span information environment, what are what are some of the must-haves? What actually moves the needle for a practice? What are some of those things that you work with your clients?
One of the first things we work on is trying to figure out something that is valuable to patients and different from your competition. It must be both. If it's valuable, but you're the same, who cares? If you're different from your competition and something that patients could care less about, who cares? So it's got to be both. And that could be, anything from you offer some treatments that none of the rest of them do. You've got a particular level of expertise. Your office just runs better. It can be anything. It's just got to be valuable and different. And the reason that's put aside everything else that's useful is that it's easier to stand out when you have something valuable that's different. If you sound and look and feel the same as all of your competition, then the way you win and get noticed is you scream louder than everybody else. And that is the most expensive way to promote yourself, because the louder it is, the more pricey it is to be louder. Better to be different. You can be more surgical strike. That's the first one. The second one is consistency. You must say this over and over again forever. You're making progress when you start to get bored, or you look at something from whoever's doing your marketing and you're like, God, do we still have to say it this way? Do we still have to say this? And the answer is yeah, you do, because there's a reason McDonald's golden arches look the same from the day that they figured it out, because people recognize it, and this matters too at the local level. So pick a couple of things, the most important things, and say them over and over and over again forever. One side note is I see this every once in a while. If you're thinking about opening up an office or opening up a new location, scout the competition. And if there are, an easy example of this is like general dentists, because there's a lot of them. If there's 6 general dentists on that, in that building, and we see this, don't be the 7th. Why would you do that? I mean, and before that, check the population, like try to get some idea. If we opened there, are there enough people to fill us up in a time that we can stomach? But what about the town next door? And there's more online considerations about how Google's algorithm works. But if you can especially if they're entrenched competitors. I mean, you got to sort of weigh this. But if there are, I mean, our family dentist was in a building of four other dentists. And oh my God, like, literally next door, small building, not hard to navigate. And so just check your competition. We worked with a client recently, wanted to open up a pediatrics practice, six other practices of anywhere from 25 to 40 pediatricians, depending on how you count full-time equivalent, within 6 miles.
Wow.
Oh my God. Oh my God. Like,
Yeah.
Look, I get the hero. I won, but you know, you can make it a little easier on yourself. I mean, maybe they don't need a 7th or a 22nd, 42nd. So valuable and different, consistently said. Think about your location if you have the opportunity to.
Hey there, Keith Reynolds here, and welcome to the P2 Management Minute. In just 60 seconds, we deliver proven, real-world tactics you can plug into your practice today, whether that means speeding up check-in, lifting staff morale, or nudging patient satisfaction north. No theory, no fluff, just the kind of guidance that fits between appointments and moves the needle before lunch. But the best ideas don't all come from our newsroom. They come from you. Got a clever workflow hack, an employee engagement win, or a lesson learned the hard way? I want to feature it. Shoot me an email at kreynolds@mjhlifesciences.com with your topic, a quick outline, or even a smartphone clip. We'll handle the rest and get your insights in front of your peers nationwide. Let's make every minute count together. Thanks for watching, and I'll see you in the next P2 Management Minute.
Speaking of advice, and you had mentioned before, the idea of a physician sitting on a panel. I think right now, one of the ways that's like growing in terms of marketing and promoting yourself is being a thought leader or a content creator. I think like whether we're talking about live events or, recording yourself and putting yourself on TikTok or whatever. What's your advice on physician-led thought leadership? How can a doctor, build that credibility as somebody who knows is an expert in a space, whether it's a clinical thing or a business thing, without having to become a full-time, content creator, tied to a chair on YouTube all day or something, right?
Yeah. What I thought of thinking about this is what I wrote down is be known for what, by whom, and to accomplish what goal. Have really good answers to those first. So if thought leadership is a way where you're going to build your practice, okay, then you're thinking about like your more local area, and you're thinking about the patients who need to find you, and you're thinking about those who could refer to you. So if you are, let's imagine in the world of cardiology, a new treatment, a new surgical procedure is sort of gaining steam, and you want to be the first, okay, then everybody in the area who should know about it needs to know about it. And the way that you are in this model, you're going to do it is you're going to be highly educational, highly, be the benevolent expert, very giving, to build trust so that people refer to you, and you have to figure a few things out. If it grows beyond that, though, I mean, the marketing plan comes back to the goal. Who do I need to know that I do this? What is it I want to know? Who needs to know it? And why am I doing this? What's the goal? And then kind of go from there. As far as like the channels, whether it's video or podcast or whatever, that can all be easily figured out. But if you're just spraying stuff out there, which is what's going to happen if you skip over what I just said, then 6 months, a year from now, a certain amount of money and time will be spent. You're going to stare at a bunch of metrics and go, well, did we get there? And then if you're honest, you'll say, get where? We never figured that out. So figure that out first, like anything else. And then it's just, you can change what you figure out. Sure. But you're pointing at something. Who needs to know it? What do they need to know? What do I want them to know about me? And why? What's the goal?
So, marketing, I think a lot of physicians, it's probably not 100% accurate way of thinking about it. Thinking about bringing in new patients. I want to attract new patients. It's obviously that's part of it. What about retention of patients? Trying to prevent them from leaving you and going to the competition. Obviously, we talked about good care as sort of a must. So, like leaving that aside, what are some of the high impact ways that a physician in their practice can try to use that like service marketing to try to keep those patients, reduce, no shows, improve that sort of internal visit efficiency and keep
Mhm.
patients loyal, like all without not like having the patients feel like they're just being sold to all the time.
Well, yeah, I mean, well, don't sell to them all the time.
Yeah.
I mean, and if that's not really an issue for you. It's an issue for you if you, depending on the treatment service mix that you have. Um, I'll give, a good example. So general dentistry actually has some good lessons to learn here. It's not a group that we work a lot with, but I can speak to my family dentist. So I have a night guard. 8 or 9 years, he's saying, one day, very off. And then one day he said, Carl, you got to go. And he showed me a picture. You're beating the hell out of this tooth. So it was, my point is, it's clinically appropriate. Like in my mind, if there's a legit need for you to recommend to a patient, you really ought to do blah. Because, and here's the reasons why. They might say yes or no, but that's not salesy, that's education. The difference is, in my opinion, salesy in the negative, gross way that we all think about it is when stuff is pushed at you that you're thinking to yourself, I don't know why I need this. When the need is there, then an option is this is an option. Another option is not, but this is a legit option. Nobody's salesy, I don't think, in that regard.
Mm-hmm.
The other side, and so he didn't do that. And 8 or 9 years later, I finally went, yeah, you're right. Can't argue with that. Let's go. How fast can we get this done? The other side, the other thing that they do really well is like the operationally scheduling, reminders. I have become totally reliant on the text message appointment reminders that I get. Totally, like I'm like a kid. I know they're coming. It's in the calendar, but when I see those, I go, okay, here we go. And then scheduling the next appointment, rescheduling, it couldn't be easier. Any forms I have to fill out so that when I show up for my treatment, I sit, I'm there like, 15 seconds. They call me in on time. If they're late, they tell me. It's just a really, if you think about, what upsets people, what upsets your office and what upsets you, the patient. It's just making obvious things difficult. Obvious things difficult. So scheduling and there's so many services and systems out there. Probably your EMR has a way to do this, and maybe it's just buried deep in the feature set that you just haven't found. But and then if it's easy to schedule and reschedule, your front desk is happier because they're not fielding as many calls, depending on this. So everything, make it easy. And the it is a very large 2-letter word here, but just take the steps. What do we ask them to do? Schedule, reschedule, fill out forms, refill out forms every year, whatever it is. Send your insurance card again. I mean, I go to my primary care and I have to I'm waiting 20 minutes because there's a form they can't give me, and I have to give them my new insurance card, even though nothing's changed. It's all handled by the front desk. I go to a specialist. I get the app reminder 3 or 4 days prior. It's all done. Pictures uploaded. I walk, done. Why can't it be that easy? It's sad. It has nothing to do with medicine, nothing to do with the practice of medicine. But again, your competition could be doing it. And it's so easy for people to switch. And if you're traditional insurance based, you get like 12 minutes with your patient. The deep relationship that you would love to have with your patients, harder and harder and harder. So make the relationship with the practice pleasant.
Before we wrap up, a couple more questions. How should independent medical practices measure success? In the year, I will say, obviously this year is 2026. So we'll say this year, what metrics do you, in your experience and, the clients you've worked with, which ones actually predict growth and success? What are those metrics that you should really target and really pay attention to as you kind of make your way through the year and all the ups and downs and challenges of running a practice?
Mm-hmm. So, patient revenue is built on how many patients come in. There's a few metrics, right? There's a few variables. How many patients come in? What's the mix of treatment? How much churn is there? There's a handful of reasons why any patient's going to leave any practice. If you can affect those as you go along the way, then if you can make them better, you'll end up better. If they end up falling off, then you're going to be worse. None of those change, I think, in 2026. In my industry, in the marketing industry, every year is the year of something. This is the year of video. This is year 6 of the video. Video is 2026. And you go back and look, it was 2020, 2019, 2021. Maybe this will be the year. So I've learned, cut out the noise, because whatever else, practice owner who's listening to this, you think I need to do this or that. If the revenue and profit is not there, those other things are they're going to fall off your list, as they should. Patient satisfaction. Are you getting reviews? Are you reading and reviewing the reviews? There's gold in there. If two patients on their own, or even if you ask them, say remotely the same thing, good or bad, there's your pattern. Don't overthink it. 10 more think the same thing. Address it, good and bad. If something's really good, try to make it stronger. If something is sort of even slightly negative, just have a look. See, the front desk was rude. Maybe they were having a bad day, or maybe there's something really, systemic in there. I pick on them all the time because they're an easy example, but for the most part, they're wonderful. Patient satisfaction, employee satisfaction. I mean, hiring's hard, labor market's tight. You got a key employee and they walk out, that's going to hurt. Make sure, at least, unless you want them to go, but you know what I mean? Like, these things you should have your finger on the pulse of these small handful of metrics that tell you. And if you don't know what those are, take the time with your accounting firm, with your marketing agency, if you're using whoever's got your HR people who have those few metrics where you can look at that, say once a week and in 5 minutes go, yep, we're good. Or red flag, let's watch it, whatever it is, because you own the place. You and your partners, or you alone, you own the place, and you need to know these things. What about no-show rate? What about, you could bury some, like there's a bunch of them, but there's usually a subset that really predict the rest, and that can give you, finger on the pulse of the overall health of the practice as you define it. So go with those. Yeah. Take some time to figure out. But once you get it, it's the first time that's can be a little painful to put together. Not really, but if you're curious and you're analytical, which you are, then it can be done. Plenty do it.
Okay, great. Last question. Is there anything that we haven't discussed that you think it's important for physicians or practice managers to consider about these topics?
With marketing, just don't forget about HIPAA. Marketing and HIPAA do overlap. There's a lot of marketing agencies out there that are not HIPAA compliant. You don't have a choice. Of course, you all know about HIPAA, but I've just learned it's kind of a blind spot when talking about marketing. So make sure we're HIPAA compliant fully through and through. Make sure you check the right HIPAA boxes. As an example, one thing we do with a lot of clients is help them get more reviews from their happy patients. If you share with us their name and their cell phone number, their email address, which you will need to, we now have just a tiny kernel of protected health information. We're in HIPAA land, as I call it. So just make sure that those checks are in place. Compliance matters, as you know. That's not why you would choose any service provider for anything for compliance, aside from being compliant. You need them to do their job, but in a compliant way. So you have to do both. I would say that.
That's a good one. Carl White, thank you so much for sharing your insight today. I really appreciate your time, and thanks again.
You as well. I appreciate the opportunity. Thanks.
Once again, that was a conversation between Medical Economics Content Vice President Chris Mazzolini and Carl White, the president and founder of MarketVisory Group. My name's Austin Luttrell, and on behalf of the whole Medical Economics and Physicians Practice teams, I'd like to thank you for listening to the show and ask that you please subscribe so you don't miss the next episode. Be sure to check back on Monday and Thursday mornings for the latest conversations with experts sharing strategies, stories, and solutions for your practice. You can find us by searching Off the Chart wherever you get your podcasts. And don't forget, Physicians Practice will be hosting a Practice Academy event on March 19th, offering practical guidance for physicians and practice leaders on a range of business and operational topics. More details will be available soon. Plus, if you want the best stories that Medical Economics and Physicians Practice publish delivered straight to your email 6 days of the week, subscribe to our newsletters at medicaleconomics.com and physicianspractice.com. Off the Chart, a business and medicine podcast, is executive produced by Chris Mazzolini and Keith Reynolds and produced by Austin Luttrell. Medical Economics and Physicians Practice are both members of the MJH Life Sciences family. Thank you.